Hi everyone, it's Paul. Let's look at another unknown case. This is a enlarged lymph node in the neck in a 71-year-old male. And the clinical note said that radiologically he had a malignant appearing mass at the base of the tongue. So what's your diagnosis? Well, what features did we see? The arrangement of cells was kind of mixed, so there were dispersed, isolated cells as well as loose groups and sheets of cells. The cells were pretty distinctive themselves. They had quite a rangiophilic, refractile looking cytoplasm, some caudate and some spindle forms I showed you. Many of them that were smaller and rounder had a centrally placed nucleus, and NC ratio is generally pretty low. The nuclei fairly opaque looking, and there was definitely a necrotic background. In places, there were these more basaloid looking cells that did in fact show open chromatin, and it seemed very coarse. What possible lookalikes would you have to consider? Well, particularly in the head and neck area, you would have to really think about and exclude some marked atypia in a benign squamous line cyst, be that either acquired or congenital cyst. That usually occurs in the presence of inflammation, which was lacking in this case. And we had quite a lot of necrotic debris in the background, although that again can be mimicked by cystic debris sometimes. However, there's a considerable degree of pleomorphism in this case with all those spindle and caudate cells, and that basaloid looking group of cells that I showed you towards the end that showed classic malignant features is always nice supporting evidence for a diagnosis of malignancy, as opposed to cases that just contain large numbers of well differentiated looking squamous cell carcinoma cells. Of course, any history would also be helpful, but it's certainly at the least suspicious for metastatic squamous cell carcinoma. So I hope you enjoyed that case. Thanks for watching.